Hello, everyone. My name is Ilze Akuta, and I am professor in Riga Stradiņš University. And now I am the current president of ADEE. Welcome to this webinar session as part of this year's ADEE GSK Dentistry in Society Scholarship Awards. We hope that this session will give you some insight view into the importance of Society Scholarship Awards. We hope also that this will show the dentistry in society competence within the European undergraduate curriculum, and that it will also shed some light on the collaborative work and support we have been engaged in with our colleagues in GSK since 2018. And today's session will have two parts. We will commence with a roundtable discussion that brings together Dr. James Field. Hi, James. He is a lead author of the Graduating European Dentist Curriculum, and Professor Stephanie Tuber-Gianin, my predecessor as ADEE president and member of the Platform for Better Oral Health in Europe. And Dr. Brett Duane, Professor of Public Dental Health and advocate for sustainable dental practice and education. This session also will invite delegates to pose their questions, also live and also written as in chat. And afterwards, we will progress to announce the 2020 awards recipients of the ADEE GSK Dentistry in Society Awards. But before we start this roundtable discussion, I would like to invite Dr. Steve Mason of GSK to say a few words concerning the ADEE and GSK collaboration. Please, Dr. Steve Mason.
Thank you, Elsa, and I hope everybody can hear me. Sometimes you don't know with these video calls, but yes, I'm delighted to have this opportunity just to say a few words about the webinar and the ADEE Society Award, the Dentistry and Society Award. As Elsa said, Steve Mason. I'm the medical affairs lead for GSK Oral Health worldwide, and I represent my Senior Vice President, Adam Sisson, Head of Oral Health Research and Development here at GSK Consumer Healthcare. And why do we support initiatives such as this? Well, critically at GSK, our overall corporate motto, vision, mission, whatever words you want to choose it, is to help more people to do more, feel better, and live longer. And of course, for a company that has pharmaceuticals, vaccines, and our consumer healthcare products, that's an important guiding light to draw us all together about doing more for society and making people feel better and ultimately making them live longer. And within consumer healthcare, which is where we commercialize our oral health portfolio of products, our goal actually is to be the first and best consumer healthcare company in the world. And we have two underpinning drivers of science and values of consumer first, integrity, respect, and transparency. And they're important to us. And science and society is a critical enabler of our strategy. And so, yes, for 3 years, we've chosen through our unrestricted grants process to support ADEE and the Advancement of Dentistry and Society Scholarship Award because that so closely aligns, the criteria of that award so closely aligns with our aspirations and our goals, dental public health, economics, professional care, etc., etc., etc. And this is just one of many awards in this area that align to our values, and we have others with the International Association of Dental Research, and equally we support the platform of Better Oral Health Europe to promote the importance of oral health amongst the European politicians and educators and public health policymakers, because they all come together against the goals and values that we have. So I think that's enough from me, and I hope you understand why we support the ADEE and why we're particularly excited to support this event, the webinar, the panel discussion, and ultimately the awards. And just in case I don't get an opportunity at the end, I would just like to take the time to congratulate any of the award winners in advance, and wish them every success in their future career. And with that, Elsa, back to you.
Okay, thank you very much, Steve, and also GSK team, ADEE, and indeed our maybe institutions are most appreciative to you and GSK team for being able to give this award. And also about our relationships, which has grown in these recent years. But now we would like to focus on our activity and moving to our panel discussion. And I would like just to outline some brief ground rules. Should you wish to ask a question, do it please through the question window. And we will do the best to address the question appropriate. And also, I think through chat also it's possible to ask the questions, put comments if you wish. I would also would like to remind that this session will be recorded, and also this will be shared online afterwards. And Steve, or I think he's left. Oh no, not yet, not yet. And just feel free to interrupt at any stage if you also have some comments. Okay, I think now we can start our panel discussion. And I would like to start with James Field and welcome you to a session. And the first question, as an author of the Graduating European Dentist domain, why was a Dentistry in Society domain created for the new Graduating European Dentist curriculum?
Thank you, Ilse. That's a good question. So just to bring people back a little bit on the process, the task force in Europe to look at the new curriculum started around 5 years ago now. And it took the task force around 2 years to completely deconstruct the curriculum as it was and to reconstruct it again. And I think it's fair to say that the task force felt that the way in which a graduating dentist integrates and supports society should definitely be made more explicit in any future curricula. And we obviously recognize that most dentists operate within primary care. So the task force felt that it was critical that dentists knew how to practice as members of teams, they knew how to work in healthcare systems, and a few other things. They needed to be able to take a wider account for the context in which they practice. They need to effectively integrate with society. And also, and this is possibly one of the things that's the newest element, is that they should be able to advocate for general and oral health and system change. So we felt that the undergraduate curriculum should explicitly reflect those elements. And that's exactly why a Dentistry in Society domain was created.
Okay, thank you, James. And I would like just as a next speaker to ask the Stephanie, as James already mentioned, the role in oral health as a concept of the global health. What do you see as the role of dental students and oral health practitioners in the society within the global health perspective?
Thank you, Ilse. I would say that really from a public health perspective, the domain dentistry in society is very important in the education of oral health professional because dental education and more largely the education of all the oral health professionals are real key issues so that we may have a health workforce that is able to satisfy actual and future societal health needs. So indeed, the way our health professionals are educated really influences strongly the availability, the quality and the relevance of the oral health services that are delivered to the population. And it's not me that is saying that, this is a WHO position. First, dental education can help students and young graduates and then professionals to become really true public health actors. That means that we can have professionals that are competent and that are really participating in solving the society issues. So the objective is to make them become real health professionals, able to perceive, to understand and to manage the health needs of their patients and more likely of the population they serve. So, but what I would like to say is that the domain dentistry in society is specific, but it has to be considered as completely linked with the other domains, such as professionalism or patient-centered care. You cannot really separate all these. This is a whole concept. And this is a way to develop a public health perspective within dental education and to allow our health professionals to work with a holistic vision of health and a holistic vision of oral health, with oral health that is completely integrated and embedded within general health. But I don't want to be too long, but maybe Brett would like to add something about that.
Yeah, thanks, Stephanie. I mean, I guess my points are throw back to James and yourself, Stephanie, about first of all, if we are expecting, we want the graduate to be able to support society and practice what they preach in the way of being sustainable and basically do less harm as they practice dentistry. They have a role, I think, in not only being sustainable practitioners, but also in encouraging the public to be more sustainable in being sustainable themselves. And it's also important, I think, that students are not only taught how to be more sustainable, but they're actively involved in the research process. A lot of us, you know, as a lot of us are on the call are towards the end of our practice, perhaps 40, 50, 60. We don't actually know how to be sustainable ourselves. And I think students have a role, not only giving back to society and from a sustainability perspective, but also giving back to their teachers. And it needs to be teamwork, especially from a sustainable perspective.
Okay, thank you. I think all of you have pointed out very, very important parts of the dental curriculum as a healthcare professionals in global context. But maybe I can return to James and again to graduating European dentist curriculum. And what are the 5 major competences that for the new dentistry in society domain?
Okay, thank you, Ilse. So yes, as Ilse has just said, we have 5 subcategories, if you like, 5 major competencies within the domain. And I would just like to make the point before I begin, and just to reinforce Stephanie's comment that all of these elements are not necessarily considered in isolation, but they should be implemented within education as a holistic approach. Essentially, we have to define them in some way, so that's why they sit within their own domain. But the major competencies include dental public health. See if I can remember these. Dental public health, we have health promotion, disease prevention. We have population demography, health and disease. We have healthcare systems. And then finally, we have a major competence, which is about planning for health and oral health.
Okay, Brett, what other major competences would you like to see included, and why?
I'm quite happy with the current competencies that have been written by James. I guess the point is, and we mapped these recently, we looked at how does sustainability thread across all these competencies. And we've illustrated these points in a draft paper being considered by the European Journal of Education. So sort of watch this space. I guess the main point is that an example, for instance, is when we teach prevention. Sustainability underlines that prevention because there's a strong correlation between prevention and sustainability. When we see a patient, they travel in, what material we use. Sustainability, first of all, seems a little bit disparate from this, but when you actually start to dig deeper, it does align with each of these competencies very well. And as I say, watch this space when this paper is published.
Okay. And Stephanie, from a public health perspective, what is the role of dental education shaping the competences of the health professionals to face public health needs? And also maybe what competences are needed from your perspective too?
Thank you. As I said before, what is really needed is to ensure that the competencies of the future dentists or other health professionals are really in line with the patients and local population needs. And I would say that this is really a social responsibility. We speak about social accountability. This is the social responsibility of the dental schools to help the professional respond to current and future health needs and challenges in society. And there is a definition of social accountability that states that this implies to orientate education, research, and oral health services priorities accordingly. And so this has to be done at different level, local level, maybe regional level, national, international level. So this is a way of really using the graduating European dentists to structure dental education while taking into account this social responsibility. And concerning the competencies, for sure, the graduating European dentist is going to change with time. But what I would say is that we know that there are significant health inequalities and that those inequalities tend to worsen even in developed countries, and it's particularly obvious now with the COVID-19 crisis. So oral health inequalities are visible early in life with major impacts on health and oral health quality of life. But oral health depends mainly on social and commercial determinants and on people's living conditions. So for me, I think that it's very important that students understand these social determinants of health and that the acquisition of the knowledge and skills in this field be completely integrated in the curricula.
Okay, thank you. So far, may I ask you, is there any questions or some comments?
No, Ilse, there are no questions.
Okay. Thank you.
Comments.
Thank you. Then we are going to continue, and I would like to again to ask the James about domains, dentistry in society domain. Does this domain change our expectations of how dental students should be prepared for their qualification?
Okay, thanks, Ilse. I hope so. I really hope so that this domain will change not just our expectations of how dental students graduate as dentists, but also how they actually practice. And the hope here is that by having explicit learning outcomes within the graduating European dentist curriculum documents, we hope that schools will take those on board and embed the necessary teaching into their programs to allow that to happen. And in the past, some of those elements might have been kind of hidden curricula. They might have happened just on the back of other professional elements in the program. And a lot of those things also used to form parts of post-qualification elements like vocational training or foundation training programs. But we've brought them forwards, some of them into the undergraduate curriculum to make them more explicit. So, for example, in the past, we had dental public health, which formed a large part of what is now dentistry in society. But now we've got a much wider range of contemporaneous outcomes, such as the requirement to understand the healthcare systems in which they work, the requirement to understand mechanisms for how they're going to get paid and remunerated, and also kind of career choices and training opportunities as well. Some of these things got left until graduating dentists were actually in the workplace, and they should be happening sooner. And finally, I just want to pick up on Stephanie and Brett's comment that really just to reinforce the fact that this is about social accountability, but also we're empowering students to be professionally accountable as well. And we've got Steve here and the rest of the GSK team, which is fantastic. And, you know, Brett's paper about toothbrushes and sustainability, and GSK don't necessarily make, the toothbrushes, but the point is we want our graduates to be able to challenge claims made by industry. We want them to be able to raise concerns where they feel appropriate and feel that they can make a difference. So in summary, I really hope that the domain does change our expectations, but I also hope that it changes our graduates as well.
Okay, thank you. I hope so as well, and I think it does. But Brett, what do you think? What key changes need to be made to curriculum to have meaningful impact to society?
I think we've really covered that, Ilse, in the previous conversation. The only thing I would say is thanks to James for highlighting the toothbrush paper, because it does give you a really good example of the fact that we all practice as a dental team, providing what we hope is optimal oral care to our patients, but we do need to look much more broadly, and the toothbrush paper is a good example of that. The fact that it showed that if we are recommending electric toothbrushes to our patients, do our students, do we even know how harmful that could be to the planet, and how do we juggle the potential harm to the planet of the production of an electric toothbrush versus the benefits that electric toothbrush may or may not bring to our patient. And I think this is the point of these competencies, and also embedding sustainability into these competencies is how can we encourage our dental team to think broader than just the dentistry we may have practiced when I graduated.
Okay, thank you. But Stephanie, do you think that our dental and other oral health professionals right now, graduates, identify as being members of the wider healthcare team and understand the importance of their role?
Thank you, Ilse. This is a very important question because it's obvious that oral health and dental care are not enough integrated within general health and within healthcare with a comprehensive perspective. I think that many students are kind of understanding that, but so we need more maybe interprofessional education, making students from different health profession work together and better understand each other. Maybe also more education in the field of advocacy for oral health promotion, and this has been said by Steve at the beginning. And I would like to mention again the work that is being done by the Platform for Better Oral Health in Europe, that is mainly supported by GSK, because the platform is gathering people from the major European dental organizations, such as the International Association for Dental Research, the Association for Dental Education in Europe, the European Association of Dental Public Health. And I think that really the platform is doing a great job to promote, to try to reinforce oral health promotion in Europe. I suggest that you can have a look to their website. to the website where you can find a manifesto that has been disseminated to the European members of the Parliament. And there is also a call for best practices in oral health promotion. So this way of advocating could help students become members of the wider healthcare team. And I think it's very important to integrate the students with those educational activities where they can have some experience about advocacy, and again, maybe within an IP perspective. As an example, in France, we have the health service that gathers students from different health studies, and they go to the communities to do some prevention and health promotion. So it's a way to better know the other members of the health care team, and to do some advocacy about oral health and oral health promotion.
Okay, thank you, Stephanie, James, and Brett, stressing for importance of dentistry being part of the wider healthcare team. I think this is extremely important part of the stage that we are now in our education. I would like to change a little bit focus of our discussion, and let's move to Brett. Perhaps you would speak to us about your recent toothbrush publication that is causing somewhat a lot of discussion. Would you comment, please, on this?
Sure, Ilse. I mean, we touched on it briefly before, the fact that an electric toothbrush caused significant personal health harm, and that relates to the manufacture and process of any electrical item. Really, it causes health harm, and we calculated this in disability adjusted life years to show that if every electric toothbrush you recommend, I say you recommend because I think this is also part of our remit as educationalists, but every toothbrush you produce causes 10 hours of quality adjusted life year lost, if you can term it that way. But what was also surprising was that the environmental impact of just a conventional toothbrush needs to be looked at, and we recommended using a standard toothbrush with a standard plastic toothbrush with a recyclable head, and if we can get toothbrushes to be recycled as part of a circular economy, that's a much better approach, unfortunately, because I've been critiqued a little bit by the bamboo industry for saying this, but it's a much better approach from a sustainability point of view than growing a resource such as bamboo. I notice that there are 2 questions on the chat, Ilse, but I'll let you as coordinator of this seminar tell me when you want me to answer this.
Okay, thank you. Thank you, Brett. And I would like to go back to James again about the domain. I think this domain was not drafted in isolation by ADEE or whatever, and it was influenced by other publications, societies. Would you please share with us of the core organizations and policies which helped to create this domain, please?
Yeah, sure. So, people on the webinar today may well remember the consultation that we had. It was a very wide consultation, which was inviting of many organizations and professional bodies to help feedback on the domain. We had, I think, from what I remember, 200 responses to the consultation from organizations, individuals, industry, professional bodies, and regulators as well. So in terms of input to the curriculum, that was a very useful process. It was very wide reaching. And some of those responses were really very comprehensive. particularly from the regulators. Actually, we had a lot of good input in that regard. In terms of specific policies, though, we very much related to the EU's action plan for the EU health workforce from 2012, and obviously the UN Sustainable Development Goals and their global strategy for human resources for health. And a lot of those things project forwards actually into the future 10 or 20 more years. So our hope is that the way the DIS domain was put together is quite forward thinking, but it did go out to quite wide consultation at the time.
Okay, thank you, James. And maybe also Stephanie and Brett, are there any other resources and publications which would you like to refer delegates for more information? Stephanie, first, please.
I have some maybe ideas I can share with you. First of all, I have published a paper with a colleague. His name is Didier Jourdan, and this man is managing a UNESCO chair, education and health, where they try to put together the issues concerning education and health. And I think that there are some interesting things going on within that UNESCO chair. I would also recommend you to have a look to the education thematic group of the International Association for Dental Research. As an example, last year during the Washington 2020 Congress that has been held online, we have registered a symposium about the adequacy of dental education to the oral health needs of the population. So if you are an ADEE member, you can have access to the symposia that have been registered following the Washington Congress. And I would add that at an European level, there is an Erasmus Plus project that is going on. It is entitled OL-CEDU. It has resulted already in a publication that was led by James Field. And it's a scoping review about the reporting on oral health professional education in Europe. And the next step will be to conduct a survey to better understand what is the situation of dental education in Europe. And it could be a way to have more information about how the domain dentistry in society is really integrated in the European dental curricula. But I think maybe James will speak about it more broadly as the WHO, the Lancet Commission about the health workforce, or UNESCO have published many strategic documents on this issue of training of health professionals.
Mm-hmm. Okay, thank you. Brett, would you add something?
My papers are less from an educational academic perspective, but more on how do we teach and embed sustainability into our dental practice. So we have a series of 7 papers that were published by the British Dental Journal in 2019, last year. I was also asked to write a paper which has been published in the Journal of Dental Research a few months ago. These are all available on my ResearchGate profile. And as I intimated before, James and I, and I can't remember now the number of authors, James, but we have a consensus of maybe 18 authors, I think, who have recently submitted a paper to the European Journal of Dental Education for consideration, and that's ongoing. So yeah, they're the papers that I would highlight.
Okay, thank you. And I have a message from Judith so that we have 2 questions. Please, Judith, would you proceed with the questions?
Yes,
Yes.
2 questions from Barry Quinn. The first is, should governmental intervention on sustainability be strengthened as in the public health arena? It will be the paymasters who can dictate the direction of travel.
Okay, to whom these questions were mentioned, or for all panelists?
Maybe I could take it as a start. Definitely. The problem being is that no one wants more regulation, but the problem being is that generally sustainability is the cost-effective option, but it's not necessarily the cost-effective option for the individual that's undertaking the sustainable, who's making the sustainable choices. And one example is, of course, solar panels. Now they are better for the environment long term, but they require significant investment. And who provides that significant investment in order that a dental practice, for example, could have clean energy? And I would suggest or strongly recommend that governments consider how they get involved in making sustainability more relevant, and that should be both from and hopefully more of an incentivized route rather than a penalized route. But I think you need to have that carrot stick approach in order to encourage people to be sustainability. It's really noticeable in the UK at the moment. I always say big healthcare with an H, if that's clear, and for those who don't speak English as a first language. But thinking about big healthcare hospitals in the UK, they have really nice sustainable development plans, lots of things happening within big organizations, but less so in dentistry because it's just dental practice, less so in general medical practice because it's just general medical practice. And it's how do governments incentivize, not only through education, through the educational process, but also through other means. So totally agree.
Thank you very much. Would any from panelists would add something?
I think it's Steve. I would just add from the corporate world that sustainability is a key driver for part of society, and that it is actually also a differentiator of companies as they go forward. Now it's very challenging, and as Brett's paper on toothbrushes has highlighted, it is actually quite controversial. But I think a lot of companies will work aggressively in that direction, but we have to be clear on what the rules are, and life cycle analysis and assumptions and everything else in that area. But I think the market, if you accept the capitalism theory, is driving a lot of companies in that direction, and they want to do the right thing for the planet, do the right thing for the consumer at a cost and at a benefit risk equation that is extraordinarily complex. But most of the large corporates want to move in that direction and do the right thing, I think.
Okay, thank you very much.
Sorry, Elsa, can I add as well to Steve's comment that, and Brett, that the very beginning of change, certainly when you're considering capitalist models, would be in the education of our students, and our students come through, they are the promoters of the change in the end. And we might have the purse holders at the moment in terms of certainly, if we look closer to home in terms of, for example, the National Health Service, a very powerful organization in terms of how it dictates its funds and how it regulates the care that it delivers. But ultimately, our cohorts of students coming through, if they are educated properly and feel empowered to make these changes, then they will be the biggest advocates for all of this.
I do mind if I add to that. I think on top of that, if we empower students, they need to, now I just wrote, Steve, call out manufacturers, but I thought, no, I need to change that. And they need to be able to praise manufacturers and companies that are doing the right thing and put their investment where they are. But they also need to be empowered to call out manufacturers, because once you start going down the sustainability line and you start understanding sustainability more, you realize how that education then empowers you to understand, well, what's sustainable and what's not sustainable. And that's where I'd like our students of the future to be.
Okay, thank you, Brett. Stephanie, would you like to add something on this, or just we go forward?
Well, just really one sentence that is to reinforce what has been said before. I would say that there is something that is important, that is the coherence between the decisions that are taken. For example, if you want to support the students going to the dental school by bike, then you need to have a kind of a coherence in the facilities that are available for them. And yeah, we have lots of work to do with that, I think.
Okay, thank you very much for all your answers. Judith, I see you have still 2 more questions. Please, would you proceed with next one?
I do, Ilse. The first question, this next question is again from Barry, and it's definitely for you, Brett. It's, are electric handpieces more harmful to the environment than air-driven handpieces?
Just to answer that question, I have to do a life cycle assessment and make broad assumptions, Steve. The answer is we're not sure. I wouldn't even know. I mean, we're talking about handpieces now. We've moved into the dental surgery rather than an actual toothbrush. So, you know, all joking aside, you would need to do some sort of analysis, and whether that's a life cycle analysis, which is what I've been doing in the last few years. But it relates to what happens from cradle to grave. So what components are going into the electric handpiece versus the air-driven handpiece, how are they disposed of, how long do they last, etc. You can't really just answer that question without doing without somebody funding me to do a life cycle assessment on it.
Okay, thank you. Judith, please, the next question.
The next question is from Ana Estela Haddad. She's an associate professor in the Faculty of Dentistry in São Paulo, Brazil. And it's a question for all the panelists. One of the points you mentioned is that dentistry is not integrated to health systems in many cases. Are there exceptions? Is this a question that has been or should be discussed with policymakers at different countries, and also considering diverse kinds and characteristics of health systems in different countries?
Okay, thank you. May we start with Stephanie? With you, please comment on that.
This is a very good point, and I feel that they're kind of the answer in the question. I don't know exactly what is happening in different places, but if you discuss with many organizations such as the deans of the dental schools, people from WHO, people involved, for example, in the platform, or even if you speak to people at the local level, they all say that they feel that dentistry is not completely integrated with the other health professions and within a comprehensive view. And after that, in some places, people succeed more than others. And I think it was very interesting to observe in the different countries the role of the dentist during the COVID-19 crisis. It varied a lot from one country to another or from one place to another. And for example, in France, there is something a little bit weird. That is that the dental students are allowed to, I don't know how to say that in English, to do some probing in the nose for detecting SARS-CoV-2.
Swab.
Thank you. But the dentists are not. And so you don't understand why the dental students are allowed and not the dentists. So this is more related to political decision. And it's very important to really be there, have an advocate for the integration of oral health each time it's possible to do it. And for me, one important aspect behind is really to rely on evidence-based information. Because sometimes we might be lacking of evidence about some aspects. So when we have a good piece of evidence for supporting a position, then I think it's easier to bring the oral health issues within the general health subject.
Okay, thank you. James, would you like?
Yeah, I completely agree. I think in answer directly to Anna's question, I guess there will be exceptions, and as Stephanie said, and Brett, it very much depends on the healthcare system in that country. But yeah, it's an important consideration.
Brett, would you add something?
The only thing I would add is it's a shame, and I don't know how it happened, but it's happened probably for centuries. Dentistry has become more and more, well, not more and more isolated, but definitely there's dentistry and then there's broader healthcare. And I think, unfortunately, as we start to look at planetary impact and sustainability, that difference has also affected the sustainability of dentistry. And we're now, certainly in the UK, dentistry was a little bit leading, at least from a carbon modeling point of view, but now we're behind. There's a lot more things we could be doing if we were incentivized to do so. And because we're not part of the broader system, we fall behind.
Okay, thank you. I also think that this is quite different in different countries, but generally, somehow dentistry has been separated from many, many years. And I think today's discussion also shows that this should be changed in some way, and this is our task as well. Okay. Is it any question more? I have lost my count. There is one question. The new one or two already? These are new ones.
There's a new question in from Barry again. If I could just say that Anna Estelle also said congratulations to ADEE and to GSK for relevant incentive and for raising such important questions. I have to pass that on. The next question again is from Barry. Surely the most sustainable dentistry for society is prevention rather than intervention.
I said intervention, yes, totally. The point is that the less interventional we can become and the more prevention we can carry out, generally the more sustainable it is. Making sure that, of course, that the prevention is not associated with a high travel footprint. For example, if you're traveling out to put fluoride varnish, traveling 20 kilometers to put varnish on 3 children, your prevention is obviously not going to be so sustainable. So it's all it's a bit of a generalist comment, but yeah, if I said that, Barry, then it meant to be the other way around.
Okay, thank you very much for very interesting discussion and these questions arise. However, we need to some way move forward, and to finalize all this, our conversation, I would like to ask each of you for your thoughts on how the graduating European dentistry in society domain might evolve in the coming years. Please, Stephanie.
I don't know how it has to evolve, but I think it's very important that it evolves and that it adapts to the changes, the societal changes, the technological changes, the need for more sustainability, the organizational changes too. So for me, this has to be really a dynamic document, but I'm sure James will have more information to give us about that.
Yes, thanks, Stephanie. So I think it's probably appropriate that I say how the domain can change rather than how it might change. We'll leave that extra little bit for Brett as well. But from the task force perspective, the graduating European dentist curricula are open access online through the Wiley website. But also, if you visit the graduating European dentist curriculum through the ADEE website, you can interact with the curriculum elements. So you can leave feedback for the task force on the curriculum and the domains itself. And we would very much welcome anybody, students, individuals, policymakers, educators, industry, regulators, to go and to help shape the future derivatives of the curriculum. It's very dynamic. We want it to be that way. So please do go and visit the site, and that's how you can contribute to change of the domain.
Thank you, James. And Brett, would you add something?
We're talking about the future of curriculum. I would hope that sustainability would move even further from being in a sort of a what are you on about type curriculum thread to much more mainstreamed. I had a student that came up to me about a year ago and said, I just don't understand what all this curriculum mean and the need to put sustainability into the curriculum, Dr. Duane. Are you saying that students don't get taught sustainability as part of the course like we do? And I went, yes, sorry. It's really just in places like Dublin, Sheffield, and a few other places where students are taught sustainability as part of their curriculum. And it would be nice for that to be normalized across all the dental schools.
Okay, thank you very much, and thank you for your participation at this stage. And I would like to head over to Professor Stephanie Tubert-Jermyn to make the announcement of the 2020 ADEE GSK Dentistry in Society Scholarship. Please, Stephanie.
Yes, so I'm very glad to do that, and I would like to let you remember that this is the third year of this grant, and that this scholarship supports ADEE members who demonstrate excellence in dental public health within dental education. So I'm very glad to announce that this year the panel decided to award 3 scholarships. So the first one is going to Dublin Dental University Hospital in Ireland for their project focusing on an interprofessional collaboration directed at oral health care for the elderly in the residential care home sector. So through the use of teledentistry in the residential setting, the project aims to evolve a meaningful multidisciplinary experience for dental students and an enhancement of the care provided to care home residents. So I would like to welcome Svetlana Anishuk and propose her to say a few brief words.
Hello.
Hello.
Yeah, thank you very much for the sum up of our project. Myself and Yvonne would really like to thank Advanced Dental European Education and GSK team for choosing our project and non-dentists to receive the scholarship awards. And so you sum up what we want to do, but I think from teaching and learning perspective, we hope that this project will help us to explore different perspectives that nurses, disciplines, and dental hygienists have regarding oral care provision for the older population living in those care facilities. This might also influence the activities and processes that are involved in delivery of oral care and how this differs in professional perspectives. So overall, our project will help us to advance our understanding of the training needs and implement changes in the curriculum of the dental profession and hopefully nursing disciplines. So thank you very much. We're very excited. And yeah, so if you got any questions, we would be happy to answer.
Okay, Svetlana, I don't know if we can answer questions right now. Maybe we will maybe do that at the end. Judith, do you agree with that?
I agree with that. There are no questions have come in right now.
Okay, so I would like to say really congratulations, Svetlana and Ivan, and congratulations to the Dublin Dental University Hospital. And if there are questions, then we'll stay with us and we will allow you to answer to it. So, congratulations again.
Thank you.
Next is the University ACTA in Amsterdam, the Netherlands, for that project focusing on creating and developing a knowledge clip repository on dental public health, epidemiology, and health inequalities and health promotion. The clips will be integrated into teaching and learning strategies in a number of dental education programs and also oral health professionals education programs to enhance students' understanding of the dentistry in society concept. So I invite the project leader, Michelle van der Linden, to say a few words. Sorry.
Thank you so much, Professor Tubert. And thank you to all of the members of the committee and to all of ADEE and to GSK for this honorable award. And I also need to mention that, like many projects and ideas, the Knowledge Clip Repository project has more than one owner and more than one inventor. So I should thank also my colleague Denise Duister from Social Dentistry at ACTA, who was one of those who started this. And we worked out a plan together, not just to record knowledge clips, make interviews with experts, and record and make good use of other people's knowledge, but also to keep these knowledge clips not just to ourselves, but to create a database or a repository, if you like, and to share these clips with others. We're developing right now this database. This is a growing and ongoing process. But I'd like you to see that we don't use the knowledge clips as a standalone feature. At ACTA, we feel that this kind of innovative, activating resources should be used, combined with other activating working methods with students in order to make them aware and enhance their position as primary care workers with full awareness of their position in society and to bring dental public health further. So thank you very much.
Thank you very much, Michel, and really congratulations to you, your colleagues, and to ACTA. And our third and final scholarship goes to the Faculty of Dental Medicine, the Medical University of Sofia in Bulgaria, for their ongoing efforts to update and embed the concept of ethical dental practice within undergraduate curriculum. So the current project within this scholarship is supporting, this will enable the publication of an e-book, Essentials of Social Medicine and Medical Ethics, that will be made available across all relevant programs to encourage best practices and the ethos behind the dentistry in society concept. So I invite now Lydia Katrova to say a few words.
Hello to everybody. Dear colleagues, it's a great honor and a privilege to be nominated for this prestigious fellowship. Please accept my most sincere gratitude for the interest in our long efforts to put together in fact and figures the concept and features of profession and professionalization of dentists. The Faculty of Dental Medicine delegated the task to advance teaching and learning practices relevant to the dentistry in society domain to the Department of Dental Public Health established in 1991. And our department grew up along with the growing of the idea of harmonization of dental education in Europe. We were so lucky to compose and enrich our program with the advancement of all achieved by colleagues in other similar departments and other dental schools. Now, after this sudden problem with the COVID epidemic, we should start without any preparation the online teaching learning process. So we got aware that we need to focus on our efforts in improving our knowledge, ability, and tools to enhance this process of e-learning. As a first step, we organize our teaching online, and we try to gather the feedback from the final examination last session and keep in touch with the other departments of dental public health in order to improve this process of dynamic and appropriate understanding of problems, improve communication, and improve the ability of new graduate dentists to solve problem as independent practitioner, but still remaining sensible toward the community problems. Thank you so much.
Thank you very much, and congratulations again, Lydia, as well as your colleagues from the Faculty of Dental Medicine.
Thank you very much.
Maybe Ilse, we have time for one or two questions for our recipients. I let you.
Yes, I'm ready to answer if there are any questions.
Yes, but Ilse, you are on mute.
Oh, excuse me. Excuse me.
Hello, Ilse. Okay, thank you.
Okay. Okay, thank you. So thank you, Stephanie, very much. And congratulations to all. And we have time just for one more question, Judith. I see you have already two, but please, Judith, start with first one and then we will see how it goes, how quickly it goes.
Thank you, Ilse. A few people have said congratulations to GSK for this initiative. Barry Quinn is asking, what would be the easiest sustainable change a dental school could implement?
I suppose this is a question for Brett the first, or any other panelist who would be able and who would like to ask this question. Brett, start with you, please.
I guess the question to Barry that I would throw back is, are we talking about an institutional change, as in the UK, and we often have the dental school, which is educating the students, and then we have the dental hospital, which is providing the treatment for the patients. If it was an educational question, the first thing would be obviously to implement sustainability into the curriculum and provide thematic lectures or however you educate the students. If we're talking an institutional, notice that Judith's just written Barry means institutional. That's a really difficult one. I would suggest the first thing to do would be that you would come up with an organizational sustainability policy, and then create a strategy from that and look at what you could do from a change point of view. Because one thing a institution has significant power in is its procurement. And that might be quite an easy change to do, is simply work out what you're going to procure and start talking to companies about what's good from a procurement point of view and what's the most sustainable procurement. But yeah, it's a really difficult one to say. You really need to meet with your team, create a policy, and then implement that policy based on what you feel is doable within your region. I mean, if you're in London, which I think you are from Googling you, Barry, you need to be, public transport is obviously sorted. So I would suggest you read the series of the BDJ series, and I'm happy to chat offline if you need some help.
Thanks,
Is
Brett.
there anything James would add?
Yeah, Ilse, can I add to that? I think that it's a very good question that Barry's asked there, because the next logical step for educators is, what do we do next? What is the next easiest way, given that all of our funding is tight and our curriculums are full? What's the best way to move this forwards? And some of the work that we did through ADEE, we found out that actually one of the simplest things that you can do is to raise awareness amongst staff and students about sustainability, without getting complicated with how we teach it, how we sustainably procure things, because actually most educators and students don't actually know what sustainability really means. They might understand a little bit about environmental sustainability, but not about sustainability in a wider sense. So I think to answer Barry's question, one of the easiest things you can do, which we did at Sheffield, was just to introduce a very simple one slide infographic at the beginning of everybody's lectures, which raises awareness for around 30 seconds or a minute about what sustainability is. And once that's carried on for a few months, or even across a term or a year, you can begin to build on that. But initially it raises awareness within the staff and student body of what sustainability is. And I think that's our biggest hurdle initially.
I could add to that, I guess, yeah, asking the students would be a great idea, because students, they've grown up being more and more aware of being sustainable, and then they enter these institutions and are blown away by how badly unsustainable we are. We throw things out, you know, we don't reuse things, etc. So James, yeah, good, much better answer than me, James. Ask the students. And you need a CEO and a head of school that are on board. And the other problem being is that once you start educating the students, you'll create conflict, but that conflict is necessary to start system change.
Okay, thank you. I think this will be open question a long time. Maybe Stephanie, do you have some ideas to add?
Oh, I think we have had a very interesting discussion, and for me there is an interesting link between all the discussion we have had within the panel and the projects that are being presented by the recipients of the scholarship. So I feel that there is kind of I was talking about that before, kind of coherence in terms of objective to develop more public health, oral health promotion and sustainability within dental education.
Okay, thank you very much. And I think we are very close to closing our session, and it's a very interesting discussion. And as we see, it's only starting, not ending in reality. And I would like to thank you all for joining us in this session today. And of course, also thank the panel for the very interesting discussion and contribution and time you spent with us today. And we look also forward to hearing the progress on the previous recipients of the scholarship in coming sessions. And to close, I would like to thank GSK team and Steve, you personally, for your ongoing support for this important initiative. And the session will be hosted online for reviewing, and afterwards post-production page will include additional links and some referring material. So thank you very much for joining us, and the session is closed.